Today's video is about binge eating, also known as anorexia nervosa or bulimia nervosa, its possible causes, common signs and symptoms. Part 1. If you are interested in such health-related informative content, please make sure to follow our YouTube channel, subscribe, like, share, and press the bell icon. Simply called anorexia, is an eating disorder. People with anorexia place a high value on controlling their weight and shape. Anorexia nervosa involves compulsive dieting and exercise to reduce weight, leading to dangerous weight loss. Bulimia nervosa is characterized by binge eating followed by purging. These individuals believe that they are fat and have disaffection from body image and try to be perfectionist. They have a distorted perception of weight and aim to have an abnormally low body weight, with an intense fear of gaining weight. It's an extremely unhealthy and sometimes life-threatening way to try to cope with emotional problems. They severely restrict the amount of food they eat. They may also try to lose weight by exercising excessively. The person continues to feel fat even when emaciated. It affects most often teenage girls and young women, although boys or men can also suffer from it, usually from the middle and upper socioeconomic classes. It is thought that the current society's emphasis on slimness is a mark of feminine attractiveness that contributes greatly to such disorders. Anorexia is the third most common chronic illness among adolescents. Physical signs and symptoms of anorexia may include extremely thin appearance, not making expected development in weight gain, weakness, fatigue, and lack of energy, low blood pressure or feel dizzy, sometimes fainting with an inability to tolerate cold. Skin looks yellow, pale, and dry. The hair may become thin, breaks easily or fall out, and the nails may get dry or brittle. Sleeplessness, insomnia, concentration difficulties, constipation, abdomen pain, stomach cramps, discolored/eroded teeth, tooth decay from induced vomiting, muscles weakness and low immunity, abnormal blood counts, bluish discoloration of the fingers, soft, downy hair covering the body, absence of menstruation in females, irregular heart rhythms, low blood pressure and sugar levels, dehydration, swelling of arms or legs, slower respiratory rate, and dryness of mouth. Emotional and behavioral symptoms: severely restricting food intake through dieting or fasting, exercising excessively, binging and self-induced vomiting to get rid of food, misusing laxatives, diuretic or herbal supplements, preoccupation with food, that is cooking meals for others but not eating them, frequently skipping meals or refusing to eat, denial of hunger or making excuses for not eating, eating only foods those low in fat and calories, spitting food out after chewing, not wanting to eat in public, lying about food has been eaten, fear of gaining weight, repeated weighing or measuring the body, frequent checking in the mirror for perceived flaws, covering up in layers of clothing, flat mood or lack of emotions. They feel fat even when they are underweight or feel as if some body parts are too fat. They may lack emotion, have depressed mood, withdraws from social activities, and tend to have low libido, that is decrease of interest in sex, and low self-esteem. Causes of anorexia nervosa. An effective holistic approach is to identify and treat the causative factors. The exact reason behind anorexia nervosa is not known yet. Some possible causes may include family history. A chemical called serotonin produced in the brain is suggested to play a role in it. Major stressful events in life like relationship breakup, death of a family member, unemployment, change of job/school, some major family problems, etc. History of being bullied or teased about body weight. Physical, sexual, or emotional abuse. People having certain personality traits and emotions like sensitive to criticism regarding them, prone to anxiety, depression, and difficulty in handling stress. Society and peer pressure to look thin. People having OCD, obsessive-compulsive disorder, are at risk. Puberty teens are at more risk due to hormonal changes at this age their body is going through. Changes in certain hormones which control the mood, appetite, hunger, or thinking. The disease is mainly encountered in the Western world and is more common among in certain professions, such as models and ballet dancers. Or history of slight overweight. Further complications of anorexia if left unaddressed: severe malnutrition, anemia, severe dehydration, impaired bowel movements, thyroid dysfunction, impaired heart functions, loss of bone mass, osteoporosis, increased risk of bones weakening and fractures, recurrent infections, swelling or bloating of body parts, loss of muscle mass, electrolyte imbalance like sodium, potassium, and calcium, hormonal problems that may impair levels of growth hormones or low testosterone in males, gastric troubles like constipation, bloating. The patients may have suicidal thoughts or indulge in self-harming activities or attempts to suicide attempts. Thanks for watching. Please watch part 2 for its holistic remedies.